We are thrilled to share his invaluable knowledge, expertise, and insights into this discourse. Ladies and gentlemen, please join me in giving a warm welcome to our distinguished keynote speaker, my own boss, Dr. Ultrasound.
Please have your seats. Thank you so much. Good morning. Honorable Minister for Health of the Federal Republic of Nigeria, Dr. Ultrasound, all the deputy and assistant ministers here present, senior government officials, ladies and gentlemen. Good morning. I must say today I'm truly honored. I have never received in my life a standing ovation. So I'm going to tell my boss and my wife that I did received a standing ovation this morning. I'm honored to be here, and I would like to congratulate the Honorable Minister and of course the Ministry of Health and all the partners who have contributed to the development of this very important manual. I will like to put things in perspective. Because I have 20 minutes, but don't worry, I'll finish before 20 minutes. I'll try to do it in 10, 12 minutes. But I want to put a few things in perspective, even though the previous speakers have spoken about it. When you look at globally, we have an estimated 257,000 women dying yearly due to complications from pregnancy. And when we talk about children, we have about 2 million stillbirths and 2.4 million neonatal deaths per year globally. You will agree with me that these are big numbers. We don't want our women to die. We don't want our children to die. Nobody wants it. So it's of a big concern to us. And if you look at it, behind each of these deaths, there's a mother, there's a family, there's a child, there's a community. So for us, it's important that we work together to ensure that these deaths are prevented. Because in the essence of the word, they are really preventable. The burden of these deaths is disproportionately borne by low and middle income countries, as you know. Our health systems are weak, we have infrastructural deficit, and because of that, we in Africa, we in the developed world, we bear a huge burden of some of these deaths, which to us is unacceptable. Of course, most of these deaths are driven by complications during pregnancy, as have been highlighted by the CMO, and complications during childbirth and immediate postnatal period. So, why is it that obstetric ultrasound matters? I think a bit of it has been said, but I just want to highlight 2 or 3 points why we think it's really important. It ensures that there's access to timely, good quality screening and diagnostic services, which is provided by skilled health personnel, and which is a critical strategy when we want to reduce maternal mortality and morbidity. Ultrasound is an important component of routine obstetric care. As both a screening and diagnostics tool, it helps to accelerate to accurately determine gestational age, detect high-risk pregnancies, identify complications such as placenta previa and the others, and guide timely clinical decision making. Because of this, we in WHO in 2022, we recommended that at least one ultrasound scan is done for every pregnant woman before 24 weeks of that pregnancy, and as part of the routine AMC care. So we are really glad as WHO this morning that Liberia has taken the great stride to achieve this target through the development and validation and of course the rollout of this manual and the procurement and distribution of portable ultrasound machine to the lower level of facilities. I want to just emphasize a couple of points, Honorable Minister and the distinguished guests here. This manual is a means to an end. It is not the end in itself. The end for us is to make sure that all pregnant women have access, to ultrasound services, and we hope that if we pick any complication, then we'll make sure that they are referred and they get the quality kind of care they need. So I want to propose practical approaches to ensure the successful achievement of that aim. The first one is that the manual and indeed obstetric ultrasound should be integrated into primary health care to ensure that it is easily accessible to all pregnant women, including those in the most remote communities in Nigeria. And I will emphasize on that a bit later. We may not, put the ultrasound at the community level, but there are certain things that we need to put at the community level to ensure that people use that ultrasound. Secondly, and I'm happy to hear that this is already happening as elaborated by Dr. Moore, it is important to use task shifting and other innovative workforce capacity expansion strategies to ensure availability of trained lower level midwives, nurses, and physician assistants. As we know, in our settings, we will never be able to have radiologists or medical doctors at every level. So we need to task shift. We need to take some of their responsibility and give to lower people. But of course, like the CMO said, they need to be trained. And that is why I'm also happy that we have this manual. Thirdly, the deployment of portable point of care and low-cost ultrasound machine backed up by the required services and maintenance facility at the national and county level is an imperative. It's already happening, but the most critical part of it, we must have in place maintenance and service facilities. Because what normally happens a lot of time is very quickly they get broken down. A lot of these things are actually, they are not analog, they are digital. And when they get broken down, then it becomes a bit of an issue to fix them. So we need to look at ensuring that we have in place services for maintenance and of course for servicing. It's also important because if you have the ultrasound and you have done this scan, it has to trigger actions. And that action is whoever needs it, we are able to move that person quickly to care. I just came back from a trip to the Southeast and I was telling the minister, I was pleasantly surprised and impressed that almost all the facilities that we said were open and the healthcare workers were there delivering services. I saw women at maternity getting home. And finally as well, the CHO were very proud, Honorable Minister, to show me their new ambulances. So, please, let's put those to use to refer our pregnant women. And I'm particularly appealing to the CHO. Don't let's use these ambulances for administrative purposes. Let us use them, to transfer patients. Importantly as well, Honorable Minister, if it's not being done, I think we need to invest a bit in telemedicine and digital health. As we know, lower level people can come up with a scan sometime in between, they're not sure. But if we have telemedicine facilities, then we can link them, to radiologists, to obstetricians, in the bigger centers who can help them to quickly interpret and make decisions. The cost, of course, we're happy that the ministry has invested massively, but we want to ensure that we're able to buy more. We don't buy it one time. So, Honorable Minister, I'm looking at you and saying that we need you to help us to advocate to finance and to the other stakeholders to ensure that this is incorporated in the budget. Not only to buy the service, but also to maintain. And importantly, when we want to replace, we have to pay for them. And we don't expect that they will last, for a lifetime. So we need to replace them at some point. Governance and oversight system is important for anything we do. Because very quickly, if we don't have a governance and oversight system, for the training, for the use of the equipment, then we can quickly go into a bit of problem. Importantly, lastly, we must not forget about the communities. The communities are so critical. I visited the maternal waiting home, and as much as the pregnant women were very happy, they were good with it, but they said, "Oh, there's no food, so we're not coming." So we don't want that same thing to happen to our ultrasound, to the people we have trained. We need to engage the community. What will make them come? What are their fears? Because people, if you tell me to come, you're going to put something on my stomach, it could mean a lot of things. So we need to engage the community and ensure that we get a buy-in. So as I close, I would like to call on the Ministry of Health under the able leadership of the Honorable Minister to ensure the wide dissemination and full implementation and usage of the manual by integrating it into the national health policies, strategic documents, training curricula, and that the very lower level healthcare workers are trained on it. And I'm so happy to see that there is a plan to already do that, and we're starting on the 1st of July. Well done to the people who have put this together. To our partners, including WHO, I want to urge you to align your technical and financial support behind this country-led scale-up of this manual and obstetrics. Not only this, I really want to appeal, to all my colleagues that look, it is the country's priorities, and we all need to align and ensure that we support it. For us in WHO, we are already working to support at least this initiative, and I want to assure you that more will come, more is coming. For our frontline healthcare workers, I urge you to make good use of this manual to deliver safe, high quality, and equitable obstetric care. If you are committed, you can make it happen. To everyone present here today and all Liberian healthcare workers and stakeholders, I call upon you to remain united and to steadfastly ensure that no Liberian woman and no newborn is left behind due to that lack of timely diagnosis and care. This manual, together with the necessary obstetric equipment and consumables, are strategic investment in survival, equity, and dignity of Liberian women and units. Let us ensure the effective use to transform obstetric care to healthier pregnancies, safer births, and stronger communities in the country. Once again, I congratulate the Ministry and the Minister of Health and all the people who put this together, and I'd like to thank you so much for listening to me.
Thank you, Dr. Olu. Now we are at the key part of this program, which is the official launch. But before then, I just want to give a short story. I remember when the minister called me, she said, "I want for you to drive this ultrasound and let every part of Liberia have access to obstetric ultrasonography." I said, "Okay, Doctor." Dr. Popu Dennis and I went in our meeting. But when we got look, the next day she was at JFK doing ultrasound herself. And that actually prompted us to put that picture on the ultrasound manual, because she is the driving force of ultrasonography in Liberia. Thank you, Honorable. So now we are going to call on our Honorable Minister of Health, Minister Louis Martin Poto, for the cutting of the ribbon of our ultrasound manual. And she's going to do that in partnership with our keynote speaker, Dr. Olu. Kindly welcome, Honorable Minister.
Please have your seats. So, Dr. Olu, thanks for that keynote address that you did. You can rest assured that there are some of the things that in the keynote address as it relates to the service of the ultrasound machine. We at the Ministry of Health, we working in concert with TNA and to establish a biomedical school coming this September because we saw that. And you will be surprised to know that we have a biomedical office right in the yard of the Ministry of Health that we have all the equipment to jumpstart the school. We also take keynote of the foods at the maternal waiting rooms. I've visited very few countries like Malawi and other countries, and I actually went to see the maternal waiting room and how does it work. And what I've noticed is that the women in the maternal waiting room are the ones who do agriculture work. They plant vegetables and they bring rice from home to be able to sustain the maternal waiting room. So we will try to work along with the agriculture ministry to see how we can be able to sustain the maternal waiting room because it's very important to maintain the women there. So thank you for those head-ups. You can rest assured that we are in motion for most of the things that you said. I want to say thanks to Doc. Please come back. As Dr. Poppy Bolo said, I'm a preacher's daughter. And sometimes I will just see somebody, she's very quiet, but she's resilient. And once I saw her there, I told the chair of her department, the director, Dr. Ballon, I told her that I want Dr. Cynthia to lead this charge. And she definitely came to me. Thanks, God. Thank you very, very much. And with the time and tenacity that she has, I'm sure that this will be cascaded to the entire country. We now have ultrasounds in most of our clinics. The training is the problem that we now have. Skilled workers to actually diagnose. The first training we did was look at location of the placenta, the location of the fetus. So basic training to be able to have early referral. So the first identification, we look at location of both the fetus and the placenta, correlating with the time of the gestational age to be able to have early referral. I think one of the problems we have is early referral. If we can refer our patients earlier, I will be able to help. And the maternal waiting room, that's where it comes in. Because if somebody coming from the last mile, they come to the room, they'll be able to be there, closer to the health facility, and will be able to tend to them just in case of any eventuality. So we are working on that. I want to also take this time to thank the county health officers. I'd like to get feedback from the field, not always positive feedback. So I spoke with Dr. Olu, and I asked him when he came from the field, I wanted to know what he saw. I think he's very honest with me. If he has seen anything negative, he would have told us for us to be able to improve. I usually tell people, you're not reporting. You're only helping the health sector to become better. Because we can be everywhere at the same time. When you go to the counties, take pictures and send it to us to places that we haven't reached. We'll be able to improve that particular area. And that's what he did. He came and he praised. He said a lot of good things that's happening in the county. So, county health officers that are here, can they stand up? Thank you. I also like to, Dr. Sanon, can you stand for JDJ Hospital? Dr. Tamara from JFK University, both of you, please stand. Yeah. So I was speaking with Dr. Olu as it relates to referral, because he and the same thoughts we've been having. JFK should have only referral cases. You cannot just come from outside and just walk into JFK. That's why JFK is becoming overwhelmed. So if we can reach the stage that you have to get referral from Dr. Sanon before you get to JFK. You have to get referral from one of the health centers, from Grand Bassa County, from Bon County, before you go to JFK. Then the pressure on JFK will decrease, and then now you have adequate health care at the JFK Medical Center. So I want to say thanks, Dr. Sanon, for the work that you do. And Dr. Tamar, please extend my sincere thanks and appreciation to your team, and tell Dr. Brush I love her. So now, to the students, thanks for coming. So now, this is my baby.
Yes.
You will be remiss to know that I even started writing an ultrasound book. With my limited knowledge. I did a draft, and you know I missed no one also. I know everything. And I called the team. I said, I have this ultrasound draft that I did. Then I thought to myself, well, you're not radiographer. How can you who will validate your book? Then I thought about those at JFK. We have very, very, very good radiographers there, and they are very also supportive. So we call them in, and they came and look around with ultrasonographers, and they look at this. And after that, they ran with it this time at JFK. Dr. Tama, thank you very much for allowing your team. They are extremely busy at JFK. Their workload is so high, but yet and still, they took the initiative, the radiographers, the radiologists took the time to look at this book and be able to validate what we have initially. And there were a lot of things I had missing, being an OBGYN, what to add about ultrasound, to read an ultrasound book. So, but now we have it. I wanted to know, I don't know, Dr. Olu, can we put it on the website of the Ministry of Health? Or what do you think? I was wondering whether, but after we have disseminated it for example, before we can put it on, we do not have to place it up on the website now. Dr. Masekwa, what are your thoughts? People can give you the mark before. Yeah, let hear Dr. Masekwa's stuff. You can come out, Dr. Masekwa, please come and hear your thoughts. Yeah. Now here, Dr.
Yes, thank you very much. And of course, the minister is always like this. And, we talk most of the time, and I must say she has given some of us all in this business the privilege to speak to her. You can always speak to her, and this is good of you.
Thank you. Thank you.
Obviously, this is a good idea, and in fact, I would say 200% it should be on the website. Okay. The reason being, I've worked in many African countries, and I've seen how what we do here, we don't share our information.
Yes.
And in fact, I will have time to talk, so I will give also my.
Okay. All right. Thank you.
But I think it should be 200%.
Dr. Olu?
Okay, well, if my elder has spoken, I cannot say what I can go with what he said, but I just also want to make another suggestion. We can actually do QR codes of them.
Yeah.
So we have small card QR codes that anybody anywhere can scan. You just scan it and then you can access it.
Definitely. Dr. Olu is very smart. He always gives brilliant ideas. The last time, we want to launch, the ministry wants to launch the fluids, want to start doing fluid production. Because I was thinking when we had this scare of Ebola, if the worst comes to worst, in this particular butcher strain, one of the treatments, fluids, who will want to give you fluid? Everybody will keep their fluid. So we in Liberia, how do we maintain our patients, just in case of any eventuality? So I was discussing that we need to produce fluid. I spoke with the pharmacist, and we all consented. We went to JFK, we found the area where we should start the production. But when I told him about it, he said the private-public partnership will work best. So thank you. Now he tells us the QR code. So thank you, Doc. These little tips usually help. So I'd like to call the ultrasonographers up, those in the t-shirts like myself. Please come up. Okay, come, please. Let's clap for our soldiers. They're all ladies. So this, you see these powerful young ladies? You get your wife pregnant. When they tell you this is breach, this is breach. Yes. When they tell you refer. Don't see them looking quiet, looking young. They got the skills. I have tested some of them. I have trained some of them. Now they have become better than the trainer. Can you imagine? So, the other day, Grace, now she's one of the best in the country. She's one of Grace, come on. Don't see her looking like this, pretending to be quiet. That one is trying for meta. So, personally, then we have Rebecca and all of this. Carmen, come on this side also. These young ladies. The picture you see over there. Okay, go back. The picture you see over there. When the ultrasound that was not done at JFK, it was at Soniwen Clinic. Clariton Clinic. So because I know their skills, I just called them. Please come. Let's go to Clariton and the places where we send the ultrasound. Let's start. Because I don't like delays. We distributed the ultrasound. They are sitting in boxes. They have not yet been used. And we need this particular referral system. We need to reduce maternal mortality. We are only 365 days. I said today I'm not going to the ministry. I put on my scrub suit and I called them. When we got to Clariton, we got to Clariton first. Yeah, before we went to Soniwen. Okay, I went to Clariton, I didn't take your, no, I took Grace, I went to Soniwen. Soniwen, the machine was still in the box. So, the big doctor here, she doesn't even know how to put the machine together. So I said, Grace, I pretend now, Grace, come put the machine together. Grace and Carmen, they clean the exam on the machine, they place everything together. And the nurses were there, they were kind of amazed. So I took the probe. I said, Grace, how do you need probe? You know, the teacher so they didn't have, I think they didn't have gel or something like that. So fortunately for us, we had a patient there. And we placed the patient on the bed. We asked for consent and everything. And I did a scan there to find the sex of the fetus. They were giving me the hard time. I said, Grace, like I should have woman. As an instructor, you get the patient for this thing here. So Grace, can show me if you say no this thing. Come in. So the way they for the sex. And you know when you are doing ultrasound, you cannot be definitive about the sex because at times you will tell them it's a boy, and when they go and give birth, it's a girl. They have both boys' clothes. Now the owners will be like, oh, the doctor lied to me, the nurse lied to me. So you have to say there's a high probability that the sex is a girl. And I say, I think it's a girl. For me, I usually say, I think. But there's a high probability. If we're putting on a scale of 1 to 10, I will take it at 8. To get that 2%, that 2, that you can maneuver in your maybe a few boys. So, and then they look and they saw the sex of the child and they said, then I look at, I got small little skills for them, I said, so thank you, that's how all of them are. You see Joyce, she's at Tuporo, and they all very good. So I just want to say thank you, please give them hands up together. I think they are the one that are working with Dr. Bravo that will be running the field will start also helping in the various primary health care facilities. I think they've already started growing the primary health facilities in Monserrate County. So thank you, have your seats. I just wanted to let you know. I think nurses, they are powerful. Some of them, they have master's degrees. Don't see them looking so quiet. Some of them are two different masters in different areas. See them looking so humble and quiet. They are giants in their fields. So Dr. Olu, please say for everybody to see. So it gives the water. So it gives us immense pleasure to launch this book. So we call it Ripping in the name of the Father. In the name of the Father, the Son, and the Blessed Holy Spirit. Wow, this is it. So this will be in the health facilities, and just as Dr. Olus is saying, you have a just look at them while you're on the field. And I think people who have this book will be very privileged, because some of us had to go on the internet, read about the cases, and as the patient, we looking at the patient, doing our own diagnosis, we go back to the internet. So because now this is just there in the health facility. Thank you, thank you, thank you, back in your team, thank you. Thank you very much. Definitely. So, Dr. Bracco, I think this will be distributed to the health facilities that will be here. Then, as we go about doing more production, we can give it around the country, and we ensure that it's uploaded on the internet with QR code. Yeah. So the next one, I will have to put QR code.
Thank you.
Thank you very much, Doc. We appreciate this. This is a big deal.
Yes.
This is a game changer. Don't look at it, this is a big deal. And as the president said, so good things. So good news.
Thank you, our honorable minister. The brain behind the daily dose of good news. So, now we are going to relax ourselves by listening to a drama by Lopu Kolu and her team. Lopu, you can come here.
Good morning, everybody. Come and tell me what the people do. Once there's something shop, you see, you won't just wash it. You know, they say to the new way, you do the action. Whatever they say to the new way, will miss you. Oh, they was the dog in the Atana. They baby, you know, just very bad. Quite now, one come. Money. I don't want you. Me, I let one come see you, Joy. What is it in another day?
Yeah, no, they say hold it.
Oh, Brandy, and one man they want to be and when you do, you have to pay attention with me, Google.
How you doing?
All right. You see the man drive, and I can say it.
I did order. The last one you can't get, ultrasound people, you do it. When you do it, what the result? The ultrasound people I give.
I don't know what you talking. Let me sit down here and answer with you. You say ultrasound with it? I tell you, I say anytime before I will give me money, I have to steal for him. I will give me money to do ultrasound.
They don't want you to money. They say like anything they get from behind you kind of way. The reason you see I did the ultrasound before. Now,
and let me tell you something. And I say, and I will let say I want for you. And I want to be humble. And again, they better, and I want to go out boy. I go to see, again, and you want to run away. So let me tell boy, the baby, if that boy, he take it back there, I take it with the value. What I say again, I want to see the baby. Then you tell the baby picture, and baby, I go give it to that man. Before you can say, you want to get that boy, and he are that man. So we're fighting. Anybody who know it, like it would do. I want to be humble.
The reason I won't wait for the ultrasound, I won't know how they baby now in your stomach. I won't know the water if the water all red on a baby. I won't know the baby eating on if they all red. And also to know the way of the baby. Now Jeff coming to know if I hear a boy coming boom. So the important thing about the ultrasound here.
But you not tell me all I want to eat. I want to do that and drink. So I can't go to the door. What are you saying?
Sorry, I want to tell you now. So you do want to do it. And the woman is putting that here to tell you today. And you see, they get all the ultrasound book. Again, cover in the process.
What when I join you, sir?
Yeah, what the lady say now? What the lady say? Again, now in the book here, very good for us. Again, come on through the process. You see me? I just do my own thing here. They treat me, the people they call me, they treat me so hard. 3 to 8. You see the thing they are in? I want to do all the people there ultrasound here. So a good, a very good. Want to know.
And to let you when you're talking and know who getting sir. And I grow more from heaven ministry. What you call that? That will do it. Thank you very much.
Now we are reaching at the end, and we are going to call our partners for remarks. We are going to start with UNFPA, if at all they have any representative here, because they were formerly, okay, I'm not saying any. Next is a chief. Do we have any representative for a chief? They were also called. CHI. CHI. Thank you.
Good afternoon, everyone. I'm Elena M. Kamoy from Community Healthcare Initiatives. On behalf of CHI, I want to congratulate the Ministry of Health and partners for the launch of this important guide. It is an important tool for improving maternal and newborn healthcare services in Liberia, and we are pleased to be part of this important effort, and we're working along with the ministry to make sure that every woman have safe delivery, and we'll make sure that every child or children have the best care that they deserve. Thank you.
Next, we have Clinton Health Access Initiative. Thank you.
Thank you. This is a milestone for me from the Clinton Health Access Initiative. I'm a trusted partner, I should say that. The minister knows that. And we'll remain committed to so because we're not invited to this, we are already there. We remain committed to provide whatever possible technical support, material support for this initiative. That said, I quickly will go into what the minister knows I do best, and that is to give some advice. There is, I saw the phase 5, and I want to add phase 6. And phase 6 is research and development. On that note, I want to challenge the Liberia Obstetric and Gynecology Association to take this as the pilot or project, because they lay out the whole trajectory how it's going to go. But you need that professional body as a country to follow it through actual research. That is, all of the places that are going to do this, you can develop all-time use case. You see, what happens is that when you bring an intervention and then you don't follow it through with use cases,